My name is Harvey Fineberg, and I'm the president of the Institute of Medicine. The Institute of Medicine is an independent private organization in the United States that is mandated by an original charter from the Congress to the National Academy of Sciences to serve as an advisor. And our role is to advise the nation on matters of health. We advise government agencies, the professions, and the public on ways to improve health. One of the interesting things is that we're able to bring together experts from across a whole spectrum of fields to answer important questions about health. And the capacity to do that and to have the role that we do on national and local policymaking is really quite a privilege. The Institute of Medicine has been in operation for more than 40 years. And over that time, it has really helped to shape policy in the United States on many important health issues. For example, in the 1980s, with the HIV pandemic, the Institute of Medicine brought attention of the nation to the importance of prevention. Later, the Institute of Medicine was in the leading role of pointing out the problems of safety and the need for more quality in healthcare, establishing that every year tens of thousands of patients would die because of errors in medicine. And that is a very important contribution. More recently, our reports have helped to shape policymaking on everything from nutrition and the prevention of obesity, the cessation of smoking, how we deal with traumatic brain injury in our returning veterans, and many other areas of health policy today. We have a very special role in our society and relationship to government. Metaphorically, I describe it as arm's length tightly clasped. I mean that we keep our distance, but we also stay very relevant to the important questions of the day. We try to maintain a level of integrity and credibility in the work that we do. And by protecting the integrity of our own processes and guarding against conflicts of interest, balancing out the biases that different experts bring, and keeping an open availability of the materials that are submitted to our committees, and making all of our own reports public, all of this contributes, I think, to the credibility of the work that we do and make it more influential. There's so many projects that we do that are of great significance and of consequence, and they're both domestic and international. I'm very proud of the work that we did, for example, in evaluating what's called the PEPFAR program, the President's Emergency Plan for AIDS Relief, in its global reach. We have a very important study on the global burden of cardiovascular disease and the strategies to help the world to overcome this very, very high burden of disease. Domestically, we've done important projects advising on preventive services for women, on helping the nation to deal with the obesity pandemic amongst especially our children, but really the entire population, and always bringing a kind of emphasis on quality and patient-centered care to the delivery of health care. This has been one of the most enduring, important contributions of the Institute of Medicine to elevate the quality of medical care and to improve the outcomes that patients experience. One of the areas in which I was personally involved at the Institute was in our work on vaccine safety. I had the opportunity, actually, before I became president, to chair the first committee that looked at vaccine safety. This was a pertussis vaccine question, pertussis and rubella. We subsequently have done more than 10 studies on vaccine safety, including some very contentious questions such as the safety of vaccine in relation to a potential cause of autism, where our committees found very clearly that there's no association scientifically found between vaccine and autism. But these are very controversial issues in the minds of the public. And it's been very interesting for me to see how the work that we do can have an influence and still not completely carry the day, that it doesn't lay to rest all of the public concerns. And it says to me that all of us in science and medicine who are concerned about the health of the public have to be continuously focused on communicating clearly, on explaining the evidence, on understanding the real concerns that the public has, taking those into account, and trying to work together with our colleagues and with our representatives of government, the people who represent patient interests, to work toward improving health based on science and evidence. There are many reasons why science and evidence alone may not carry the day when it comes to decisions about health. For one thing, the science isn't always definitive. There are doubts and questions even among the scientists and controversies about how to interpret the evidence. But beyond the science itself, people come to a question about, for example, the use of tobacco or diet from different points of view. Sometimes individuals or companies will have a commercial interest in a particular product succeeding or selling more widely or being used more broadly. And sometimes people will have a vested interest that's not necessarily financial, but still they have a commitment to a particular idea or ideology that shapes the way they understand and interpret the evidence. So we're all human beings. We're a mix of thinking about things logically and irrationally. We're motivated by our own interests as well as by a feeling of wanting to do more for the common good. What we try to do at the Institute of Medicine is to put forward the scientific foundation for the evidence. We know that's not the whole story, but we hope that it does help everyone to see more clearly what are the options, what are the trade-offs, and what choices would often be the best ones for us to make individually or as a profession or as a society. One thing I would say is we have to remember that we should be somewhat modest in our expectations. The decision-making process is very complicated in an individual, much less in a society. And we have to understand that people approach problems from very different points of view. Nevertheless, I feel it's essential for science and evidence to play its role. I tell our staff at the Institute that the reason to make our studies excellent isn't because when they're technically right, they will ensure their adoption. Instead, I say, just in case they do have an effect, we want to be sure that they are right.